experience. We can give you what we have heard from other patients, the second-hand knowledge that we have through our research and our doctor's advice, but we are not experts. So we are not the best resource. But to find the best resource, the number one thing I would say is to ask your doctor. Or there's also the American Brain Tumor Association and the National Brain Tumor Society, which is where I get most of my information. And anytime I want to know anything about brain tumors, those are the two places where I personally go. They are excellent sources of information, funding, and both are excellent research facilities for people that live with brain tumors. So that's my disclaimer. We are not claiming to be experts, any of us. There are approximately 23,000 new cases of malignant brain and spinal cord tumors in the United States each year. 23,000. That's a lot. And I think one thing that gets confused a lot and that I had to really study about because it kind of makes me angry is staging versus grading. In normal cancer, the staging process assesses the spread of cancer beyond the original site. Brain cancer does not behave in the same way as other cancers. Tumors may migrate within the brain, but it is very rare for primary brain tumors to spread outside of the brain or away from the central nervous system. So brain cancer is usually graded rather than staged. The brain tumor grading system features 4 distinct grades to provide your care team with an understanding of how the tumor grows. This process helps doctors match brain cancer treatments to individual needs. So that's why you'll hear people say that they have a brain tumor, not brain cancer. It's really, really confusing. And they'll say that grade 1 and 2 are not cancer. They're called benign. And in my personal opinion, that's why brain cancers don't get the funding that they need or the attention that they need, is because of that stupid word benign. If you have a mass in your brain, it may not be a high grade, but it's anything but benign. Benign is a stupid word for them to use. That's just my personal opinion. But because they name it by how it's going to spread rather than how it looks, that's where we get those terms. So it's a very confusing process. And the background on this slide are what different kinds of brain tumor cells may look like. So that's what, and then this slide is about the same thing. What's the difference between a malignant brain tumor and a benign brain tumor? Benign brain tumors grow more slowly, but they can press on nearby areas of the brain. They rarely spread into other tissues. I wish we had a different word for it than benign, but and then malignant tumors are likely to grow quickly and spread into other brain tissue. So that's the difference between the two. It's not that the benign tumors are not dangerous. It's just that they're not necessarily going to spread into the other parts of the brain or other parts of the central nervous system. Primary brain tumors are cancers that form inside the brain or spine. There are more than 120 different types of brain tumors. Some common types of primary brain tumors include glioblastoma, glioma, CNS, and meningiomas. But there's 120 different types. Secondary brain tumors are tumors found in the brain that have started somewhere else in the body. These are also known as metastatic brain tumors and are more common than brain tumors. So if you have lung cancer and it spreads and it ends up in your brain, that's called a secondary brain tumor. What are the signs and symptoms of a brain tumor? The signs of a brain tumor differ from person to person and depend on the tumor location and size. Some symptoms can include, but are certainly not limited to, headaches that are new or worsening, especially in the morning or when laying down, frequent nausea or vomiting, dizziness, loss of balance, or the room spinning, trouble walking, vision, hearing, or speech problems, weakness, another word I hate, unusual sleepiness or change in activity level, changes in personality or mood, such as anger or emotional withdrawal, or an inability to focus. Those are just a few. Also, seizure is a huge sign of brain tumor. The risk factors for brain tumors. Most brain tumors do not have an obvious cause. Some factors that may increase risk of brain tumor include radiation exposure, immune system disorders, or family history. But most of the time, we don't know what causes them yet. That's still being studied. Some of the genetic syndromes that are associated with increased risk are NF1, tuberous sclerosis, von Hippel-Lindau disease, Li-Fraumeni syndrome. And if you believe you or a loved one may have one of these disorders, speak with your doctor about a genetic testing and prevention, please. How are brain tumors diagnosed? In addition to a physical exam, doctors will first perform neurological exams to test a patient's mental status and coordination, as well as exams to test vision. And then there's also diagnostic imaging, such as CT scans, MRIs, PET scans, angiograms, and myelograms. Some of these tests may be repeated to find out how much of a tumor remains or to plan further treatment. There's also biopsies. Biopsies are used as a tool to diagnose brain tumors. Brain biopsies take a piece of tissue from the brain and test it for cancerous cells. This is typically done after imaging tests reveal a brain tumor. Once you have your brain tumor out, that it is usually analyzed for genetic and molecular abnormalities. These tests can pinpoint, diagnose exactly, and that helps the doctor target more precise therapy, such as what chemo you need or what type of radiation may be helpful for you, those type of things. And then, how are brain tumors treated? The number one way that brain tumors treated is that they're not. It's called watchful waiting or watch and wait, where you just closely monitor and make sure that it's not growing out of control, and the doctors just keep an eye on it and they don't really do anything about it. Usually you'll be on your medicine to prevent having convulsions, but it is very common for people to be on watch and wait. But the number two thing is surgery. If your tumor is operable, they will remove as much of it as they can safely, but it depends on the size and shape and the location. of your tumor, but anytime that they can get it out, they will. Radiation therapy. There are all kinds of new radiation therapies now. Thanks to brave people like Jeff, who paved the way for us with things like proton therapy and IMRT, which is what I had. We'll talk about that later. And there's chemotherapy and targeted therapy. We have not had a new chemotherapy for brain tumors in 40 years, but immunotherapy is a new thing that is on the horizon, that is starting to go through clinical trials. That is very promising. It's shown success in other types of cancers, and they are starting to look at it for brain cancers. Patients may also want to consider a clinical trial for brain tumor treatment. 100% on that. I'm for it. And so now I would like to introduce you to the Brain Tumor Trust. It's a new name that I have given to the group of us at Bind. I should have put the Bind Brain Tumor Trust that have survived brain tumors. And what we're going to do is we're each going to go through one by one and tell you our experience with brain tumor. And we're going to do so in alphabetical order because that just seemed like the way to go. So I am going to turn the microphone over to Agatha, and she's going to tell you about her experience.
Right. Thank you, Jenny. Hope everybody can hear me. And so I was diagnosed back in 2016 with a glioblastoma multiforme, also known as GBM for short. Most of the glioblastoma are grade 4. Mine was a grade 4 as well. I was 54 when I was diagnosed, which is kind of the typical age, I think, for people that are diagnosed. Mine was discovered by vision issues. I had really fine vision even the day before. I went to a Rangers game on Sunday. I went and everything was just fine. And I went to the mall and bought nice colorful clothing and everything was just fine. And the next day I signed on to the computer and I had vision issues. And I had the glare and things like that. And so I went to my primary physician, who referred me to a ophthalmologist, who very quickly diagnosed me with something was wrong. And I went to the ER from that, where they diagnosed my brain tumor. I didn't have many symptoms before. I did bump into doorpost, and I had some issues with typing. And since my job involves a lot of typing, I didn't have that before. That was very unusual. My brain tumor was about the size of a ping pong ball. They always diagnosed it with interesting ball sizes. So this is glioblastoma. GBM is called glioblastoma, is a fast-growing glioma. It develops from a star-shaped glial cells that support the health of the nerve cells within the brain. GBM is often referred to as a grade 4 astrocytoma. It's the most invasive type of glial tumors. It's rapidly growing and commonly spreading into near brain tissue. GBM can arise in the brain de novo or evolve from lower grade astrocytomas or oligodendrogliomas. In adults, GBM occurs most often in cerebral hemispheres, especially the frontal and temporal lobes of the brain. GBM is a devastating brain cancer that typically results in death in the first 15 months after diagnosis. I'm happy to say next month I will be making my 5-year anniversary.
Woohoo.
Yeah. So I'm like in the 3% of people that make it to 5 years. Very unusual. So I'm very happy and thankful that I've made it this far. I was diagnosed in June of 2016. I had a craniotomy. It's a fancy word for brain surgery to remove the tumor. Then I had 6 weeks of daily Temodar, 7 days a week. And then Monday through Friday, I had, for 6 weeks, I had radiation. And that was followed by 12 months of high dose Temodar, 1 week every month for a year in 2017. So that's 4 years ago now. So that's, so here are some of my deficits. I have limited vision, especially field vision, because I lost eyesight on the left side of both eyes, as well as the bottom. So I can no longer drive a car. Excuse me 1 second, please. Dave, be quiet. I'm sorry. I'm trying to make a presentation. I'm sorry. I'm sorry. I can no longer drive a car, but I did just get my new Texas driver's license. So for Texas, they apparently are allowing driving a car, which is kind of funny. But I don't drive, even with a driver's license. My husband, thankfully, drives me wherever I need to go. Glare and light sensitivity are 2 big ones. That's why the Star Wars movie is not good for me with so many flashing lights. It really hurts my eyes. So light and sound, if I go to a restaurant, I have to really watch and make sure that the music is not too loud, because that really hurts my brain. And like anybody that has done chemo, I've got major fatigue. I've got balance issues, walking, of course, memory that most of you probably have too, especially short term. I can no longer do multitasking. As a female, I was very good in multitasking, but unfortunately no more. And I have a bit of an anxiety too. So those are kind of my deficits.
Okay, awesome. Thank you so much, Ag.
You're welcome. Thank you.
We are so glad that you have beat the statistics, and we pray for you every day here at our house.
Thank you. I appreciate that. Yeah,
So,
it's amazing.
you are.
It's a lot of work, you know. That's why I sometimes don't like the word survivor. I prefer the word warrior, because every day we fight.
That's true. Very true. It's very emotional as well.
Yes.
So, but thank you so much for sharing about what you've been through and about your tumor. We really, really appreciate it.
Thanks, Jenny.
Up next, we have Jeff.
We should design a brain tumor warrior t-shirt. Maybe Jenny can design one for us.
Ooh, I like that idea.
Yeah, I think that'd be cool.
That would be really nice.
Oops.
Yeah.
Oh my goodness, I went too far. I'm sorry, guys. Jeff, are you there?
Yeah, but my phone's about to die.
Okay. Look, can you see how much you can get through? And then if your phone dies, I'll finish up for you.
Well, I can't read anything. Am I supposed to read my slide?
Do you want me to do it?
I guess so.
Okay, and then you can just bust in if you want to like expound on anything or talk about anything.
Sure.
Jeff has an astrocytoma, or has. I guess it's has.
Have,
Okay, and
I still have it.
he was 21 when he was diagnosed back in 2002, and it was discovered by an unrelated MRI. And before his diagnosis, he had double vision, difficulty speaking, and loss of coordination. And the size of his tumor was approximately the size of a grapefruit, if you can even imagine that. So sorry, guys. And astrocytomas are a type of brain tumor that can form in the brain or spinal cord. Astrocytoma begins in cells called astrocytes that support nerve cells. Astrocytoma signs and symptoms depends on the size and location of your tumor. They can cause seizures, headaches, and nausea. If they occur in the spinal cord, they can cause weakness and disability in the area affected by the growing tumor. They can be a slow-growing tumor, or it can be aggressive cancer that grows quickly. So what grade was yours, Jeff?
They never told me.
I never
It
told
was
you.
slow growing now.
Oh, okay. So it was probably a 2. I'm just guessing.
They said it had been started when I was 5 years old and had been growing since. And I'm 40 now. I was 20 then, so 15 years old, the whole tumor.
Yeah, I'm gonna guess it was a 2. That's my best
Okay.
estimate. Because if it was a 3, it would have grown faster. So that's just my guess. So his treatment timeline, his first surgery was on his 21st birthday, and he'll be 40 in May. He's had 5 brain surgeries altogether. And during his surgery, a resection of the cerebellum was made in order to reach the tumor. So they cut right through his cerebellum. And so the fact that he survived that is a miracle. 30% of the tumor is still there, but it was killed by radiation, which is, again, a miracle. Jeff was one of the first patients at the Lance Armstrong Cancer Center, and Lance Armstrong paid for his radiation. So he paved the way for a lot of people. So that's pretty awesome.
Did you ever look that up, Jenny?
I did look it up. I couldn't find a lot of information because of the whole scandal involving
Yeah.
Strong. It's hard to find information. It's like the cancer center tried to distance themselves from him a little bit. So there's not a lot of information out there anymore. But despite the scandal, I'm still grateful that God got good out of it, and that you're here to tell the story. So, and that did do all that good.
He signed his book for me.
That's awesome. That's a
Yeah.
treasure. So some of Jeff's deficits are ataxia. Jeff, would you like to explain that to us? What ataxia is?
Damage to the cerebellum that makes the cerebellum controls your coordination. So like now that you have damage to it, your coordination, like your brain sends neurons to other neurons, and the communication doesn't go right, so everything shakes and twitches, and that happens throughout your whole body. So like my breathing is affected and everything is affected.
Walking, everything.
Yep.
Jeff also has double vision, difficulty speaking and loss of coordination, which goes with the ataxia. So he is a rock star and pushes through to do everything that he does every day. Sorry about that. Anyways, thank you, Jeff.
Sure.
To the presentation. Anything else you wanted to tell us?
Not really.
Okay. And then this is me. That's me and Joel the day after my surgery. In that picture. My tumor type was an oligodendroglioma. And I was 37 when I was diagnosed in 2013. My tumor was discovered because I had a really bad seizure. And before that, I had headaches, but I didn't know that because I had headaches pretty much my whole life, I didn't realize that it was unusual, the type of headaches that I was having. I've also always had photophobia, which is like where the light actually like hurts my head, like sunlight. I always have to have on dark sunglasses and like to keep it pretty dark in the house because light actually hurts my head. And I've had that my whole life and never realized it was anything more than just normal. My tumor was approximately the size of a lemon. So I didn't get a fancy sports ball. I got a piece of fruit. Oligodendroglioma is a rare tumor that occurs in the brain. It belongs to a group of brain tumors called gliomas. Around 3% of all brain tumors are oligodendrogliomas. These tumors can be fast or slow growing. They are more commonly diagnosed in adults, though young children can also be affected. In rare cases, the tumors can spread throughout the central nervous system via the fluid around your brain and spinal cord. Oligodendrogliomas are typically divided into two types: grade 2, which is slow growing, and anaplastic grade 3, which is fast growing and malignant. My original tumor was grade 2 and had aspects of grade 3 throughout it, which were also the grade 3 parts had actually calcified. So they were so old that they had actually calcified. And so thank God that's probably what saved me. My treatment timeline was in 1993, I had one random seizure and they saw a speck on the MRI, but it was dismissed as a shadow or maybe that I moved in the MRI. And I took anticonvulsants for a very short time. Nothing else of note ever happened, and it was just dismissed as a fluke. But then in August of 2013, I had the big seizure that resulted in the diagnosis of behind in every brain surgery. And then 2 days after the surgery, I had a grade 3 stroke and left-sided hemiparesis. I then had 2 months of inpatient and then countless hours of outpatient physical, occupational, and speech therapy. But y'all can tell I caught
Jenny, your audio is a little bit in and out right now.
remember that.
Yep.
And then in 2019, we moved here to Utopia, I ended up having 40 doses of IMRT radiation with daily Timidar. Because the doctor said that the normal course of events, I would have had that radiation right after my craniotomy, but because I had the stroke, they decided not to do it. And so he said it gave me a much longer lifespan if we went ahead with the radiation on the part of the tumor that had recurred, because it was because of the stroke that I already had. I have a really hard time letting them cut into my head again, and it's in the same spot, so I did not want to let them cut my head. So they went ahead with the radiation, and but then in October, with my MRI, there was a spot that was lighting up, and they said that it was necrosis.
But,
Yes.
okay, there's me, no,
So we do, oh,
I had a spot that was lighting up, so they suspected necrosis, and so I had a biopsy. But the biopsy revealed that the spot that was lighting up was probably swelling from the radiation still. And but that spot still lights up on my MRI, but so far it hasn't grown or changed. It's been stable. So as of January, he let me go to 6-month MRI every 6 months instead of every, couple months. So right now I'm officially on watch and wait, and very grateful to be back on wait. But we're still keeping our eye on that little recurrence spot. Hopefully it'll stay inactive because of the radiation and whatnot. Anyways, my deficits are left side hemiparesis. I have really bad spasticity, drop foot numbness in my face. I still have horrible headaches, and I have emotional lability with extreme anxiety. So y'all know that about the emotional lability. I get frustrated and temper flare and that kind of thing, which I've seen that. So anyways, that's my story, and I'm sticking to it. Up next, we have Rick. Rick, are you there?
Yes.
Hey, your turn.
Okay, I had what they referred to as a central neurocytoma. And the thing you should know about that is it's pretty rare. I think it's even more rare than Jenny's. It's like 1% or 2%, something like that. I was diagnosed at 35. I'm now going to turn 50 this year. So wow, I guess it's almost going to be 15 years. But I had headaches that were, I'd always had like mild headaches, but these were very severe. But they weren't like on a regular basis, but every so often I would have one of these really bad headaches, and then I would like get really sick and vomit and so forth, which is, I guess, one of the big symptoms. And I remember one time I could barely drive home. This was toward the end before the diagnosis. And what finally pushed it over the edge was I had one during the church service. We were visiting a new church, and I had one that was so bad I just left the service and I just went out to the car. I just kind of collapsed in the car and just was waiting for my wife to come out and after the service was over. But I just like slept and just was vomiting and just terrible that day. So we went to the doctor the next day, and this was in June of 2007. And then the next day when I went there, it just so happened my physician had actually had what they call a brain aneurysm himself. And he was, I think, a little bit more attuned to some of my symptoms when I described the headaches and stuff. He was like, well, it could just be the flu or whatever, but I'm gonna go ahead and send you for an CAT scan, a CT scan. So he sent me for a CT scan, and that can show, there's a tumor there. It's not quite diagnostic, but it shows everything. And so then, he called me back in like the next day or something and was like, there's something inside your head. I'll never forget. And that was very scary. And then he sent me almost immediately, like the next day, to his own brain surgeon, Dr. David Barnett at Baylor, Dallas, who is the head of neurosurgery. So he was like one of the best. So I was sent there, and then we don't have another slide with the timeline.
Well, we've got this one next.
Okay, well, I'll go ahead and just go through the timeline. So I was sent to for a pre-surgery consultation with Dr. Barnett, and he looked at everything and asked me some questions and all of that. And then he actually pushed one of the other patients out of the way so that I could get surgery, quite a bit sooner, because he didn't have anything open on his schedule. So he basically cleared an entire day, which was a good thing, because when I had this surgery on July 8th of 2007, he spent, I think, 12 hours on the surgery. So he was in there for a long time. And the reason was because he had to essentially go through what they call the corpus callosum. And for those of you who don't know or have forgotten, that's basically like the connections in your brain that transfer everything between the left and right side of your brain. And the tumor was down underneath, kind of in the ventricles of the brain, the areas that circulate the cerebral spinal fluid and kind of keep everything going, keep everything cleaned out. So he went in there. See, I knew there was another slide.
Yeah, but okay, it's fine. Just go ahead with what you're saying, and we can go back to the other one when you're done.
No, it's okay. But anyway, so then I was sent for surgery, and he was able to push someone out of the way. And of course, after surgery, you always go to the ICU. But the problem for me was I had what they called hydrocephalus on the brain. So I have a shunt, which is, you could even feel it in my head on the left side. And what happens is it goes down, it drains the cerebral spinal fluid and then goes down into my abdomen, where the body can just use its natural processes to absorb it and get rid of any excess. But what happened was during the surgery, after the surgery, there were still some pieces of brain tissue kind of floating around in there, and some of them clogged up the little tube of the shunt. And as a result of that, it was like a backup, a plumbing backup, and it caused tremendous pressure on the brain, which they call hydrocephalus. And as a result of that, I was in the ICU for a lot longer and ending up having 3 additional brain surgeries to revise. They had to go in there and they had to try and get the shunt to not clog up again. And then it would clog up again, and I would get all, be totally out of it again. And I don't remember anything from that period. Oh, I didn't even get to the part where I got to learn to walk again. I think Jenny mentioned this. There's something called the light gate. They lift you up by the arms, and then you have to use just you don't have to bear any weight, but you can learn to move again. And for me, it was just trying to get all the signals back into the right place. Then eventually, after learning how to walk again on the light gate machine, and which you saw the picture of at the beginning of the video, I was eventually transferred to Pate Brindley Creek Ranch, which is in Anna, or outside of Anna. At the beginning, that was at the beginning of September, very beginning of September 2007. And I remember that pretty well. By then, my memory was getting a little better. I remember staying in the place, but it was beautiful there. That's what I liked about it. That's what my wife had sent me there versus the one in Dallas. So I was there for about a month, inpatient, going to therapy every day and all of that. And then I went home, but I would commute out there on a little van every single day. They would come pick me up on the van. And I did that for about 6 additional months. All the while they were keeping my position at the city of Dallas. I was on medical leave, but then you only, according to the law, you only have 3 months that they have to keep your position. But they actually kept my position for about 6 months. And then after that, while I was still at pay, they were like, well, we got to open this position up unless you can return. So then I ended up returning to work. But to be honest with you, at that point, I don't think I was quite ready. My biggest deficits are my short-term memory loss, which you probably heard me complain about. And then I also have fatigue. Initially, I have, as Jenny said, left side weakness, which is common whenever you have a right brain injury, because the left side of your body, because of the transfer of everything in that corpus callosum I was talking about, everything kind of gets rewired from left to right. And because of that damage on the right side, my left side had weakness. And for about 2 years, I had substantial weakness. At first, it was like complete paralysis on the left side. So weakness is a misterm at that point. Slowly, my strength returned. I learned how to walk again. And eventually, I passed at the neurologist. They said I had a strength within the normal range for a right-handed individual. And so that's where I am now. But I still have the memory loss and I still have fatigue, so that I tend to sleep a lot more than I used to. Probably should get out of the habit.
All right, well, let's move on since we got about 10 minutes left. Let's give it the floor to Susan. She can tell us about her experience. Susan, are you there?
She's on mute.
Susan, you've been on mute.
Sorry.
We need to
I
start
have
wearing
been-
that t-shirt.
I have been dealing and struggling with pre-surgical removal of my tumor or post-surgery.
Okay.
I was found to have a meningioma, which for me was on the left frontal lobe, and that affects my executive decision making. My diagnosis was at age 60, but it's possible that because they don't know exactly how long the tumor was there, it could have happened a year before, 5 years, or 15 years before, any length of time. So my symptoms included losing 35 pounds because I seriously did forget to eat or eat healthy. I was eating vending machine peanut butter and crackers and drinking sodas for lunch. And that's not a good lunch habit. The weight loss was one indication. A greater indication was that I was going through bills and I did not understand what to do. I did not pay them. And that was a struggle as well. Since then, I have people who are helping me with different things, and that is one of them. Had some depression and personality changes. When the craniotomy was done to remove the meningioma, which was benign. The tumor was the size of a baseball. And it was right in here. Meningiomas are tumors that arise from the meninges, the membrane layer that cushions the central nervous system. The exact cause of this growth was unknown, and it's not well understood. Experts know that genetics play a role. More than 90% of meningiomas are benign, as was mine. Often they do not cause any symptoms. However, because of the different kinds of things I needed to do in my career, my executive functioning was off, and I was not able to consult correctly with people to help them grow their businesses. And that was a big change for myself. Symptoms can occur that require radiosurgery or conventional surgery, and that is the kind of surgery I had. My treatment timeline was having the tumor confirmed, or that there was a problem somewhere going on, and the official diagnosis, which utilized MRIs and EEGs. That was in October. I was admitted to Baylor Scott and White in Plano just before Thanksgiving in November 2017. And at that point, they were able to do the craniotomy and remove the tumor, send it off for a biopsy, and learned that it was not cancer, that it was benign. They then put me into a medically induced coma, and they did that because I had had a stroke after the surgery was completed. I was in the hospital all the way until the end of December of 2017. Then I was transferred to what is now Encompass, but at the time was Health South in Richardson, and stayed there through the December holidays and New Year's Eve. I had in-home rehab with a wonderful organization, and that was through June of 2018. I also went to neurospecific rehab at Pate for 1 year from mid-June 2018 through May 2nd of 2019. I started attending Bind, and we are being able to present this program to you. The MRIs that I have are performed about every 6 months, and so far they have been very helpful in determining that things seem to be working better. My deficits include a memory loss that is odd and that I've tried to learn to work with by using my visual memory and my own voice to tell me where I'm putting things. I was also, after many years of being a success in my career, I was unable to get new clients or get a job. That started being really pressure. That was brought on a lot of pressure. As I said, I had a 35-pound weight loss, and that was in about 8 weeks. So to me, that was very quickly. That was very fast, and it resulted from my forgetting how to eat healthy. Vending machine snacks are not good for lunch. I have continued to have difficulty concentrating. I have difficulty focusing, and making executive kinds of decisions are not easy. When I lost that 35, excuse me, when I lost the 35 pounds, I just thought I'd forgotten to eat, and I kind of did, how to eat right.
Interesting. I think when you forgot to eat, I remembered for you. Unfortunately.
We could make a great team.
I think it's interesting all the things that we have in common, how our tumors grew a long time before we knew they were there. And almost all of us had that same, and the vision issues and all of those things that we all have in common, even though we all have vastly different types of tumors. I think it's very interesting. 1 in 468 people are living with a brain tumor. So I think although we tend to say that the brain tumors are rare, when you tell people you have a brain tumor, there's usually a response of, oh, so that I'm related to, or that, I know has a brain tumor. So I don't, 1 in 468, that's not as rare as we tend to think of. So it could happen to anybody at any time, I guess is what I'm trying to say. But in conclusion, I would like to say what a brain tumor cannot do. It cannot cripple love. It cannot shatter hope. It cannot corrode faith. It cannot destroy our peace, and it cannot silence courage. It cannot invade the soul, and it cannot steal eternal life, and it cannot conquer the spirit. We are stronger than our brain tumors. We are warriors, and we are survivors, and we are more than our brain tumors and more than our brain injuries. And so that's, in conclusion, that's what I wanted to say. And I hope that you will, in the month of May, that you will, again, I'm going to put these back up, be on the lookout for the American Brain Tumor Association and National Brain Tumor Society are both great organizations. There's also Head for the Cure is a wonderful organization. I could put them on there. But I hope that in the month of May, you will think about these organizations and people with brain tumors, and maybe spread the word a little bit. So that's all I have for today, and it's exactly 12 o'clock, so we did good.
Great job.
Thank you.
Jenny, thank you.